Good morning, bienvenue. My name is Elizabeth Sully, and I'm the Director of International Research at the Guttmacher Institute, where we focus on producing rigorous research and evidence to advance sexual and reproductive health and rights worldwide. Today, we're sharing findings from our latest Just the Numbers Canada report that shows the impact of Canada's leadership in sexual and reproductive health and rights and family planning specifically. It also shows what is at stake with proposed budget cuts, and why protecting Canada's investments in sexual and reproductive health and rights matters now more than ever. Before I begin, I just want to extend my thanks to Action Canada and the Future Planning Initiative for bringing us together and their leadership on this critical issue. Investments in sexual and reproductive health and rights have profound and measurable benefits. Such investments not only promote health and well-being throughout people's lives, but they lead to improvements in education, in gender equity, political stability, economic development, and environmental sustainability. Canada has made bold commitments to sexual and reproductive health and rights through the 10-year commitment. Family planning makes up an important part of Canada's commitment to comprehensive sexual and reproductive health and rights. And we have seen tremendous increases in Canada's investments in expanding people's access to contraceptive care since the 10-year commitment was made. Family planning funding increased from $42.6 million before the 10-year commitment to $76.2 million for the 2023 to 2024 fiscal year. And that is a conservative estimate of Canada's funding going to family planning, with other methodologies estimating almost twice that amount. And this funding is more critical today than it has ever been before. The government's proposed budget cuts put this progress at risk, and the timing could not be worse. The United States used to provide 40% of all global donor funding for family planning, but all of that funding has been withheld as of last year. The next two largest donors, the United Kingdom and the Netherlands, have recently cut their aid budgets and funding for sexual and reproductive health and rights. That puts 70% of all donor funding globally at risk or gone. Canada provides 7% of that donor funding, and it is needed now more than ever. At the Guttmacher Institute, we have a long history of measuring the impact of family planning foreign assistance in low and middle income countries. For over a decade, we have been annually tracking the impact of U.S. foreign assistance for family planning. More recently, we've produced 2 prior reports on Canada's investments, as well as reports on the potential impacts of cuts in the UK and the Netherlands. Let me turn now to sharing what we found in our most recent analysis of Canada's current funding for family planning, and what is at stake if that funding is cut. In fiscal year 2023 to 2024, Canadian support for family planning was at least $76.2 million. This funding helped to provide 4.7 million women and couples with modern contraceptive care, preventing an estimated 1.6 million unintended pregnancies, including nearly 500,000 unsafe abortions prevented, and more than 2,100 maternal deaths averted. Behind those numbers are women who got to decide if and when to have children, young people who got to stay in school, and communities that are healthier and more economically secure because of those investments. Canada's leadership through the 10-year commitment has set a global standard for comprehensive, rights-based, and ring-fenced funding to provide predictability and sustainability over time. That predictability matters. Health systems cannot be built on short-term or uncertain funding, and we are in uncertain times. Canada's model recognized that long-term, reliable financing is essential for meaningful progress. It has not only saved lives, it has strengthened Canada's standing as a principled and reliable partner in global health and in human rights. But today, that leadership is at risk with any potential cuts to that funding. Proposed reductions of $2.7 billion to the development assistance budget threaten Canada's leadership in global health and in sexual and reproductive health and rights. For every $10 million potentially cut from the family planning budget, we estimate the impacts that will have on the real lives of women and girls around the world. That means that 623,000 people would lose access to contraceptive care. 213,000 additional unintended pregnancies would occur, 63,000 more unsafe abortions, and 277 more women would die from pregnancy-related causes. Funding cuts are not abstract budgetary decisions. They translate indirectly into closed clinics, supply shortages, overstretched providers, and people, especially women and adolescents, being denied essential care. Canada now faces a clear choice. It can sustain investments that are proven to save lives, to strengthen health systems, and to advance gender equality. Or it can pull back at a moment when global leadership is urgently needed. We are in a moment when funding is unstable and policies are being pursued by other countries that directly seek to undermine health and rights, including the United States' most recent harmful expansion of the global gag rule policy. Canada's leadership provides essential stability for health systems and communities around the world and helps to protect these essential rights that are being threatened. We are at a consequential moment. The challenges are real, but so is the evidence. We know what works, and we know what happens when leadership falters. The consequences are swift and severe for those with the least power and the fewest resources. We urge decision makers to protect Canada's investments in sexual and reproductive health and rights, to prevent backsliding on hard-won gains, and to ensure that bodily autonomy and access to care are at the heart of global development. Thank you.